Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrics. David, who do we have this morning?
Well, John, first of all, we have to say, where the heck are we? We're in our booth, and it has at Health 2021, and it has no top on it, so you're hearing some noise come in before you hear the noise from our hosts and guests. But we have today Jonathan Bush from Zeus Health, a godly-sounding company, and we're going to find out what ungodly things he's doing there.
Well, Jonathan, welcome. How did you get to Zeus or to Mount Olympus or to wherever you are right now? Like, maybe talk a little bit about you had sort of an interesting path to get here.
Long and winding road. Yeah. Well, I think agile style. We all sort of iterate on our lives and learn from our failures vastly more than our successes. And one of the many failures I had at Athenahealth, which was my first company, was that the architecture was hard for other people to use. So as I got more and more people became other to other people, certainly even within the company, but certainly without. And as technology and care delivery started to merge, more and more people wanted to control their own technology, and it was just hard to help them do it on Athena, and tried really hard to re-platform, spent a lot of money on it, maybe got clipped for spending too much money on it. But anyway, yeah, one of many good reasons for clipping me. But the thesis at Zeus is that we are finally at critical mass, where there are enough new makers of care and tech together, care tech, that they would like a platform, that they would like a set of common tools that they can skip some of the easy, bloaty work of patient registration and getting a 360, get the claims in, now that nobody's allowed to block you, but they can give you some pretty crappy data, pull that stuff together, normalize it, clean it up, get it into the chart so you don't then ask your new member or new patient obvious questions that are already answered in their past, and build stuff, build custom Athena nets, an EMR for...
Before you go there, though,
yeah.
and at the risk of turning this into a therapy session,
Yeah.
I've always been impressed with you. We both share, a little
John?
bit of military background.
Yep.
We both serve in the military. We both really believe and have a passion for reforming healthcare the right way. How did you go from direct care, ambulance driver, military service to technology?
Yeah. Well, I think that we want leverage. We want to be impactful. I loved driving an ambulance. I drove it in New Orleans from 6 at night to 6 in the morning, and had some extra. It was a gift, really gift in a way, to be brought into people's lives, those moments of their lives that were so acute. But on a big night it'd be 12 lives. 1 an hour, and on a slow night it'd be 5 lives. And I had a little bit of a, I was the one who kept them alive from, 2:48 a.m. to 3:07 a.m., and that's huge. And you get to see their lives, but it just didn't feel it didn't feel like I was making full use of all my, privilege, to use a popular term these days. And I wanted to, I wanted it to matter. I wanted to matter. I wanted to do things that mattered. And so how could I leverage that? And it started with, maybe ambulance companies could be rolled up so there weren't just one in each city. And then AMR came, and they kind of did that. And I was like, oh, I missed it, as if one company is all you need in an industry. And then I got into other, could care be delivered in leverage, with leverage? And my time in the Army, where combat medics do all kinds of, which are people that were recently dumpster diving, or drinking in the basement of Alpha Delta Phi, as the case may be, we're suddenly given this great, within the constraints of their guidelines.
You're still stabilized, save, move. I mean, it's real.
But you're given huge things to do.
Oh yeah, you're saving lives.
And I'm like, holy cow, with radio contact and with some skill training, this is better. This is. I mean, obviously, it's for the folks that are screwed out there in the world, but it's actually better care in a lot of ways. Like, could we? So, Athena started actually as a birth center concept, a maternity concept with the idea of kind of doing what the Army does, give the frontline responsibility to midwives and doulas and nutritionists.
I think I told you at Harvard Business School that was not going to scale, and I was completely wrong.
You were right. I believe Joe Lasseter was the judge of the business plan contest that we got kicked out of in the first round. And I went to him, I said, hey, I'm devoting my life to this. Like, can you tell me a little bit about why I kicked out? He said, well, Jonathan, we tried to pick either risky doubles or surefire doubles or risky home runs. And I think the maternity thing is kind of a risky double. And so that was it. Like, all right, thanks.
Go Red Sox.
But as we pumped into the thing and tried to do it, we found the only way we could really replicate our guidelines, our advice, our training across multiple locations was with a global queue, with a website, with some sort of technology that would never forget, never get bored, always be on.
And you built.
And that was Athena.
But you also built the only independent, healthcare technology company from scratch, over $5 billion. I mean, you may have been a bit of a wet exit from the C-suite.
Yes.
But that build was pretty amazing, and we still
was a great joy.
We still are an industry that has very few big billion-dollar healthcare technology. Healthcare's disrupted every other sector.
We've taken the multiple from 4 times revenue to 4,000 times revenue, and now you have a lot of multi-billion-dollar exits, which is awesome.
But they're not companies.
Not yet. And we've got Jerome Powell's been busy pumping out dollars, so we've got a lot of them, and then we gave everybody COVID to worry about for a couple of years, which caused us to try a lot of this stuff. So, I feel like this time, without, the benefit of as many sort of dog whistle successes yet as we'd like to see. I mean, I think, Livongo, again, maybe the multiple was high, but the company,
it's a real company.
Business model is
real
sound,
company.
right? Teladoc, same thing. I feel like
CareCentrix.
CareCentrix,
yeah. So we talk a lot about the beginning and the end of the alphabet and the mountaintops, Athena, Zeus. What about something more in the middle, like Firefly? You know, can they really provide twice the healthcare at half the price, or whatever it may be?
Better care at half the price. It's the same. I'm a not very many trick pony, right? It's the same basic concept as the ambulance and the Army and the, So you have these phenomenal doctors that are poking their eyeballs out at these major academic medical centers doing the same sort of non-problem care all the time, and
just to
being evaluated at as their referral, their keepage or their leakage.
No, I literally talked to the CEO of one of the top 2 or 3 academic medical centers. He says he no longer talks to his wife at dinner because she spends all of her time catching up on typing in notes into Epic every night. It's destroyed.
It doesn't feel good, and it doesn't feel right. It's not intellectually challenging at some point, and if the game is lame, you kill your character. And doctors are sort of, for a while now, in kind of kill your character mode. And Firefly's offering a new
literally suicide rates
depression,
up, depression, drug use. But what does Firefly actually
says,
do?
how about this? How about we only give you really sick people, and then we give you a super cool team, 7 people around you that are constantly connected, like one big breathing sort of Bloomberg terminal, right, of all of us on it, and we 8 will take care of 5,000 people continuously. And with the technology that they've built, and with this leverage in the care team, and with the protocols they've built that give these, it could be just a frontline nutritionist, kind of a personal trainer type, who just loves health and loves people's health challenges and is a good active listener, all the way up through a really good doc who's got a lot of years on. These guys can completely transform the model from, hey, if you're sick enough, beat a path to me, take a clipboard, pull your pants off, sit on wax paper, wait around until you get the chills, then you'll get your 6 minutes with me, right? And that switch to, the second anything comes up, drop it in the box, text it to me, just take a picture of it. And so people go from in the claims data, they're going from 1 visit with a doctor every 19 months on average to 41 visits per year, constantly. Wow. Little things, and I'm doing it. I never went to the doctor, never. The littlest things. And it turns out I understand my health. It's not for me, it's for people with mortgages and minivans who can't handle this shit. But as I use it, I'm like, God, it's better. I talk about emotional things. I never go to the doctor with an emotional thing. I'm fine. Just give me the shot or whatever.
So if you have all these interventions, 41 times a year, do they make you change course every time? Is it going to end up and then spending more money if you've got a new intervention every time?
It's like a Kanban. You've got one single thread of all these things, all the problems, all the tasks, all the messages, all the care plans that you got and didn't do, the ones you did do. Okay, what are we learning about your social determinants? What's going to work for you going forward? And so it gets better and better. Each little encounter isn't cancer. It's just it's dating. It's like
it's
we met for
relationship
coffee.
building.
Yes. And then what happens is when they do get sick, they don't go to the emergency room in a blind thing or ask a friend who you know at Mass General or whatever. They actually hit the button. And now you've got a lot of context. And so they say, go to the surgeon care, get this culture, you'll be expected, you're in room 3. I'll meet you there on screen. If you're confused or upset or have questions, just hit the button. I know where you are. I'll jump right on with you and the PA on duty.
Yeah, Jonathan, you may know this story, but I think if you know people's narratives, it changes the care. The VA has found when they can actually have people do a scribe and talk about what people have experienced, they actually thrive and get better. Just sharing the stories with the care team, which is like a novel idea, but it's the best.
It's not novel. What's tragic is that it's been recent research shows that if you shut up and listen for a while. Yeah. No, and what's also interesting is if you look in the claims data, what percentage, not of dollars, but of claims, is just doing that first layer establishment again and again and again. That initial triage, we're doing a bazillion. Every time you go to an urgent care, except Firefly members, name,
they definitely get the documentation right. They get the documentation right.
Oh, they crush it, And all those clicks just are bloat that just confuse the data about, we just want a strep culture. Don't do anything else. Or, palpate the abdomen.
So
I'm not going to sue you. I'll pay you instantly, no
I'm
claims.
I'm buying face.
You got it.
Zeus, man. The whole premise of healthcare data,
right.
You've got empires built
right.
on data dislocation.
Yes.
I have my particular data. I don't share it ever.
Right. Precious. It's my data.
How are you going to break?
It's a little spotty Rorschach mistake of data, but it's mine.
And we are surrounded by large booths of data walls.
Yeah.
Built
John,
by the margins.
They are transparent. And not only that, while we've been
Our
doing
walls
this
are
interview,
transparent.
while we were doing this interview, somebody came to take a picture of Jonathan, and a dog came sniffing over at our producer. So I'm not sure how to interpret that.
Yeah.
Could be a bomb. But John,
Psycho,
how are you going to break down those walls? Because it is.
Well, here's my new idea. Don't ship data. Everybody just perch on the same pile. That's basically the idea. Instead of shipping interoperable and you'll call me and I'll call you and we'll squirt it into a lake, which we'll look at occasionally and argue about who owns it. What if what if I built for you either low code, no code, or just really well documented API for everything you want to build? So you can build it in 1/10, 1/50th, 100th the time that you would spend if you built it off on your own. And I give you an environment to build where the operational data store already has everybody in it, where the data's already there. So now, like Spotify, most of us don't download all these songs in Spotify. We just get a lens. Oh, please, this guy. You're letting anyone in
Nope,
now.
He's not in the door.
He didn't get in yet.
That's what the dog, that's Patrick Ryan from Press Ganey trying to harass
He got
Jonathan
very
Bush.
upset I made a Press Ganey joke. Because of the paper, they're required to send paper forms. Not your fault, Patrick. It's just the law. But it makes for good jokes about paper forms in 2017, 2021. Anyway, not his fault. Press Ganey's very nice. Very good company.
They actually measure patient response, which is kind of something that's shocking for a lot of hospitals.
Right.
I think they do a pretty amazing job. But he's
over 6 feet and he's Irish and he's standing right behind me, so I'm going to be very quiet.
Pretty big paper business. But, okay, just technically, is that possible?
I don't know. This remains to be seen.
Don't say that. You've got investors.
I know, but I can always just call Jerome and have him print me some more. No, the truth of the matter is, it is about this inflection point. You look around, there are many, many well-funded companies with very strong tech teams in healthcare for the first time. They have they round to 1% market share, right? All 6,000 people here probably round to 1% market share.
$20+ billion in digital health
$22 billion in the first half
last 6 months.
of this
Stunning.
year. Unbelievable. And potentially a wave that crashes on the beach and runs back out to sea unless we grab it and hold it there, right, with common tools, common data. So all these guys are in a rush to build out a unique, Firefly-specific CRM, EHR, UDA-specific, Eden-specific, RIA-specific, group-specific. My bad. Clover specific. I'm reading the lines down the thing.
No, I met a 23-year-old guy, wonderful guy, who wants to build the Epic for PACE programs. I'm like, we don't, and he's 23 years old, Brown graduate, got a tech team, funded.
There you go.
Rocking and rolling. But
Roger Shedlin,
another version.
does all the beautiful, he's an incredible network for in vitro fertilization. Every single one of them's on a different EMR. Like, what if you could just give them an EMR only for in vitro? You're going to build out registration and task assignment and prescribing and all that stuff just to be able to have a unique in vitro experience. What if you could grab those parts and then custom build the unique workflows that are unique to in vitro? Like, there are so many use cases for that basic age-old Reggie Hertzlinger focus factory concept that are here, fully funded.
She always liked you better than me.
Well, I kissed her ass. I mean, just, whew.
So Jonathan, you get that. Now, going back to where you started in healthcare, let's say you're semi-successful and you got half of the world going that direction. It's going to reduce the cost of innovation. It's going to create more transparency. It's going to allow you to fast.
One VC partner meeting, the guy told me, it's like, you wouldn't believe what happened. Somebody in the partner meeting, well, because of the emergence of Zeus, we're expecting multiples on digital health companies to go down. I said, what? He said, yeah. He said, because now that, like, they won't be able to say that they own that
can't
tech.
charge extra.
Are you kidding me? There's so much
no
unbuilt
more toll
tech.
booth.
Just because you didn't build your own registration or patient data vault or whatever, like, that's ridiculous.
So you get there.
Yep.
What's the impact on the patient? What's the impact on the doctor?
Oh my
God. The patient who's disconnected.
We're so used to it everywhere, right? I mean, Spotify and LinkedIn. We have taken for granted in much of our life a common, reliable data object that we flick off, wherever we need to, and it's always current. And when our life changes, wherever we've flicked it, it's still current, right? If you change jobs, they have their LinkedIn, link in their recruiting system or in their database or in their contact file or their whatever, it's current, whatever happens, right? New song comes out from your favorite artist, you've got it, right? It's not that you went out and got it, it's that your lens knows that those are things to put, in the glass for you.
So how's that going to change the patient?
That's got to happen in healthcare.
So that happens. What happens when you go to your doctor? What's that interface going to be like?
I think the key to this is, if enough of these digital health companies get onto Zeus, if Zeus does a good enough job to earn it, like, remains to be seen, right? And then enough of them do well with it, there'll be a point at which they start to accumulate with their exhaust a pretty credible data graph of the American public. Once that data graph starts to be big enough, deep enough, real-time, reliable enough, now it's sort of like, better check Zeus before operating. Now all of a sudden, all the people that guard their data and moat their data are like, yeah, I want to moat mine, but I don't want to be wrong about this patient.
Is that like the mapping of the human genome, but for practice? I mean, do you basically
something like that? The mapping of the human phenotype. Here's this basic shit, and we're interested in all kinds of stuff. We're talking to, getting the link, the Fitbit feed. We really just kissing Whoop's ass, dying to get them to put their data on. And charge, accelerate their business model with it, and 23andMe. Like, we want credit card. We want to have a lot of health-related, not just these very rare, very bloated, very sort of fee-for-service claim-oriented data moments that come from EMR CCDs, but regular stuff as well. And we think that the combination of those, plus the software developer kit, will convince a meaningful chunk of the HLTH crowd. And then, if the HLTH crowd convinces enough of America, we're going somewhere.
Well, Jonathan, speaking of having a crowd today, I always like going to a conference with you. I think last time we were at a conference together in San Francisco, you peeled some guy off the pavement. Are we expecting something similar here today?
Yeah, that guy was a great actor. The guy who had the heart attack.
Yeah, that guy.
Yeah. That was odd, wasn't it?
I thought it was weird.
Walking between meetings, and there was a whole bunch of people standing around looking at this guy. And it's, a not insignificant number of them had the JP Morgan,
healthcare
thing, necklace on, credential, and nobody was touching the guy.
Yeah.
Like, he was
well,
it
wasn't scalable,
No, but
oh my God! Like,
speaks
it took
to
me
your
a
basic
minute.
compassion.
Nobody's. Well, I the advantage of numbing out whatever makes you not do that by doing it a bunch. But anyway, it was. It was tragic, and I probably did him no favors. He became alive for long enough to get rattled down to the city and die a couple days later. So it's too bad.
Well, anyway, from the small scale to the large scale, I mean, we talk a lot about companies here from A to Z. What about any kind of health reform? How does that play into what's all
Jonathan
going
has
in the private
no
sector?
opinions about
I know he
politics
doesn't.
and health reform.
I'm getting him to
no politics.
This is an opportunity
it's beneath him.
This is an opportunity to think.
I aspire to. I don't need it, like in all of my marriage counseling. I don't need it, but I would like very much if we could have sex tonight. I don't need the Cures Act to not be scuttled, but I would like it very much. I would like it very much if the magical TEFCA committee of committees actually agreed on a standard for an American to give their credential, give their permission to a tech company in a government acceptable way, whatever that may be, so that that tech company could go present this credential, this authorization to everywhere where there's data and say, bitch,
It's mine.
Betty wants this, and she wants it here. She said so. You can't say no. Give it to me. If that level of clarity makes it, and it could be a really complicated standard. I mean, we have the KYC law, which allows banks to open accounts online. It's fine. It's a bunch of dances you have to do. Show me an in-person address, letter, whatever, mailed somewhere. We know how to do this. We've done it before. There's no reason we can't do it again here, where it's so much more valuable. Not that anti-money laundering isn't important, but compared to the health of the public, it's...
Well, no, the premise of all of the privacy stuff was to actually, A, protect you, and B, allow you to be able to port your data.
Right.
And all we got was the first part.
Privacy and
we
portability.
Don't get it.
Right.
And
Exactly.
It's unclear that gajillion-dollar infrastructure...
Under the HIPAA use case, things are pretty liquid. Like, compared to where it started, we can pretty much get at anybody, at least for a shitty, bloated, PDF-y copy of stuff. It's something. And then we'll clean it up. We can do stuff. The consumer use case is people, the guys inside the club don't like these unwashed non-doctor guys coming in the club. And that's where government steps in.
You're also not a government bureaucrat. I mean, I think the privacy Taliban still is very happy to keep those walls.
Every great movement is plagued by its fundamentalists and its cynics. Everything. Christianity, patriotism, privacy. There's somebody who's using it to twist the needle. We're just doing it to protect privacy. No, you're not. You're screwing people. Oh, no, it's about privacy. They don't know enough to have their own data. I've heard that be said by a billionaire over the years. Ridiculous.
Could have been a tech founder.
And then there's the fundamentalists. There are people who are like, I'm protecting my,
Yeah.
Well,
I got my MREs, I got my weapons, I'm
back
ready.
in the cave.
You ain't getting my data. You ain't getting my data.
Well, John, you would have been wrong to bet against the Taliban, so I hope you didn't place your bet there. But in any case...
I did bet against the Taliban.
Yeah.
I lost that bet, and I know why, and I'm very angry.
Well, hopefully not going to lose against the data Taliban. In any case, before we go any further, we went from A to Z. I think that's far enough. Jonathan Bush, founder and CEO of Zeus Health, among many other things. Thank you for joining us today at Health for our CareTalk podcast. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening, and please subscribe. And Jonathan, thank you for joining, and thank you for
guys. Thanks for having me.